Good morning, College of Health Science students, more specifically pre-nursing students. My name's Jacob. I'm a peer advisor in the College of Health Sciences. You're probably tired of seeing my face, so I apologize, but we got one more event because Archer and I have gathered some nursing students that are currently in the program to kind of talk to you guys about what their experience in the program has been like. So we're very excited to kind of bring some more information to you, specifically from a nursing student. We feel like it's probably best that way so you get all the real nitty-gritty information about what it's like to be in the program, and hopefully reduce some anxiety, and hopefully you can learn a little bit about the program in the meantime. So I brought along fellow peer advisor Archer Ward, and he's going to kind of facilitate the discussion. So Archer, if you want to introduce yourself, and then maybe we can get started.
Absolutely. Thank you, Jacob. Hello, all. My name is Archer Ward. I am the other COHS pre-nursing peer advisor, working alongside Jacob. Anyway, I think, want to say a big thank you to our panelists once again. They're amazing. Really appreciate them coming along. And we're just going to get right into it. And first question, I think, just sort of talk about all of your individual and unique experiences and just sort of how you got to where you are today and sort of the path that you took. And we'll start with Dana.
Okay, so I have a unique path, I guess, which I thought it would be very unique and found out there's kind of more people in my situation than I expected. I started college in 2002 and at Boise State and applied to the nursing program and got in 2004. And shortly after I found out I was pregnant and I decided to stay home and raise my kids. And I have 5 kids. So my kindergartner went back, or my youngest went to kindergarten in 2018. And that's when I came back to Boise State. In between there, I lived in Texas for a little while and I tried to get into a nursing program at a community college and I didn't get in. So that was my second time applying for nursing school. And then I applied to start in the spring of 2020 and I didn't get in. And I applied again and I got in for the fall of 2020. There's a lot of older students in our cohort, which I really appreciate because I didn't know what to expect.
Absolutely. Thank you, Dana. Matt, you want to keep going?
Hi, I'm Matt. I'm a 6th semester nursing student currently. My story goes down more the traditional route. I moved to Boise in 2018 and I knew I kind of want to go down the pre-nursing route and then the nursing route. And I applied my first time and got in. And since then, I've just been riding through the program.
There we go. Thank you, Matt. And Jazmine?
Hi, my name is Jazmine. I'm a 7th semester nursing student here at Boise State. Similar to Matt, my route was pretty boring. I graduated high school in 2017 and then started college. After that, I applied to the nursing program my second semester, my sophomore year, and then started my junior year. So yeah, nothing very exciting about that.
Thank you, Jazmine. And Jacob, finish it out.
Yep. So my name's Jacob. I am a 5th semester nursing student in the same cohort as Dana. And I also have a pretty traditional route that I came to nursing, except I didn't come into college wanting to be a nurse. I kind of always had it in the back of my head, but I just never thought I could get into the program. So I just kind of pushed it off. I was like, I don't want to deal with that. And then my second semester in college came around and I was like, I need to go for it because that's what I really want to do. So I met with Ellie Pierce, got a plan together, and then went on and applied to nursing school. The only unique, not really unique, but different thing is that I'm on a 4.5-year plan instead of a 4-year plan because the way the nursing prerequisites are, it's better to kind of like space out how you do your prerequisites. At least that's how I felt for me. So that's kind of the only, I guess, non-traditional thing I did, but still pretty traditional otherwise.
Absolutely. So Jacob, we'll just continue rolling with you, and in your experience, sort of what you talk about, like kind of what an average day looks like in your world as a nursing student.
Yeah, busy. The first semester of nursing school, honestly, I didn't feel like was that bad. They kind of, the first few weeks are for sure, but then you kind of get into a rhythm. I see other people are maybe disagreeing, but you get into a rhythm and then you kind of get into a flow. But this semester, like this last week, has just kind of hit me like a truck. But an average day, going back to your question, is, wake up, get some breakfast. I usually have class or work in the morning, so I'll do that. And then I will work on homework throughout the rest of the evening. I try to space out my weekends where I don't have to do a lot of homework, but that is very rare because I like to give myself a little breaks if I can. But honestly, an average day, the only thing that's different is sometimes we'll have clinicals all day where you'll go in at 6:30 in the morning and then be done at around 5, and then you have post-conference for a couple hours. So that's the only thing that might be a little different from a traditional college student and the degree path they're following. And another thing that's different is we have really a lot longer classes. So we'll have classes 1 day a week for 3 hours instead of the same class twice a week for like an hour and 15 minutes. So those are really the only major differences from a traditional college student as far as my average day. But yeah, pretty typical.
Pretty typical. Jazmine, since you're a 7th semester nursing student, is there any sort of major differences there that you want to highlight, or just anything in general?
No, Jacob summed it up pretty well. It is a lot of work. You definitely have to be dedicated to it and spend a lot of time either on homework or on classes. My situation is a little different because I picked up a Spanish minor, so I have to be extra diligent about getting homework done on time. But I think Jacob did a great job. It's a big time commitment.
Awesome. Dana, Matt, anything?
I know there are a lot of people who work at like the hospital. A lot of people in our cohort, after the first semester, you can get your CNA or get hired as a nurse apprentice, I think is what it's called. Did I make that word up? And so a lot of people in our cohort have done that and gotten jobs, or they had them prior, and they all work in the hospital. And I've decided, since I am raising kids, that I'm not going to work, at least for now, during nursing school. So there's people who are able to fit in a job and all their schoolwork, and they seem to be doing really well. So
Awesome. Thank you all. Appreciate it. So Jazmine, kind of heading in a different direction, in your experience, 7th semester nursing student, what do you think has been sort of the most challenging part of nursing school thus far?
Wow, all of it? No, just kidding. It's great. Nursing school is amazing. Honestly, the most challenging part for me was just the amount of time I had to study. I'm not someone who can read the textbook a singular time and automatically know everything about every medical thing there is. So I spent a lot of time studying, making note cards, flashcards, study guides for the exams, stuff like that. So knowing what style of learning suits you best is super beneficial. Then you don't have to spend the first couple exams trying to figure it out. But I think the hardest part is just dedication, like wanting to keep going after you might not do well in an exam, or after you just studied for a week and a half straight and you got a 70%. Like, it sucks, but if this is what you want to do, then you'll keep going, you'll make it through. I found that using a homework app helps me. I have an app on my phone that I put all my assignments in the first week of school, and I use that to kind of keep track of when I have assignments due or exams, and that's worked really well for me. Some people prefer to write in a like paper and pen planner situation. That doesn't work for me, but if it works for you, I highly recommend it. Other people in the cohort will make like an Excel sheet or something with all the assignments on it. That's super nice of them because they make it for the whole class. Honestly, and I handle it by just grinding. You just have to kind of do it, get through it, and there's light at the end of the tunnel. So it's really not that bad.
Always a light at the end of the tunnel. Thank you, Jazmine. Jacob, Matt, Dana, anything to add?
The only thing I was going to say is I found it really hard to stay on top of all the assignments that are due. Like I'm not, to begin with, I'm not the most organized person, so having so many assignments due in 1 week is challenging. So I really like what Jazmine said about having either a planner or something that works for you to kind of know when assignments are due, because you have to stay on top of it. And there's been times where I have totally not even known an assignment was even a thing until, the night before it's due. So looking at your course calendars every week to know what's due that week, making a list and prioritizing what needs to be done and when is really important. But there's a lot of assignments that need to be done in a certain amount of time. But like Jazmine said, if you focus up and put your time into it, you'll be fine.
I thought one of the hardest parts coming into it, we had pharmacology our first semester of the program, and there's just so much information and you feel like there's no way I'm ever going to remember all of this, but you can get through it. And also I agree with, like, we had someone in our cohort, she made these calendars. Shout out to Summer, because I just follow it, cross off when I finish things. And it's really, I feel like it's made this semester a lot easier than the last. So one of the really great things about the program is there's so many people in the same position as you, and it's been so positive. Everybody wants everybody to succeed. There's not any kind of competition. So.
Yeah, I'd agree. I think the most challenging part is just managing your time effectively and staying on top of your assignments. And for me, planners work perfectly for me, but homework apps, there's so many things out there to help you, and you have your classmates. So just staying on top of your work and managing your time effectively throughout the week.
Absolutely. Shout out Trello. I use Trello a lot. Anyway, awesome. Great stuff. Matt, I'm going to throw it back to you and sort of talk about what's been the most rewarding part about nursing school, or your favorite, or really just in that vein.
Yeah, I think for me, my favorite part of the program definitely has to be like the sense of community and support that you get. One of the things I was worried about, because I didn't really know anybody when I was applying, was kind of being like, I guess, like alone and like not really having anybody to help or support me. But the cohort, it's just, you have like, so everybody's just there to help you, each cohort makes a Facebook page, and like if you're confused about something, you can ask a question there, and people will respond. People will like throw out their study guides, or people will throw out kind of like the calendars and Excel sheets of when things are due. So just really that sense of like community and support that you get has been like my favorite part of the nursing program. That's been the thing that's been most effective, or that's had the biggest impact on me.
Anybody else have anything to add? That always good to hear. We love a good community.
I can jump in. I love going to clinical. It's so much fun. I'd never been in a hospital before going to clinical. What is it, fifth semester? And I was terrified. I was so afraid, but everyone else in my group that was there with me was in the same boat. So you kind of just huddle around together and, watch your nurse do things, but slowly and eventually you'll gain more confidence and feel like you have the ability to do stuff. The first time I ever gave someone a shot, I was shaking, I was nervous, but the nurses are great. They're there to help you. They want you to succeed because they want you to be a great peer for them eventually when you get hired. So they do everything in their power to make sure that you're learning, that you have every opportunity to go do something new or see a procedure, something like that. So it's been amazing to go to clinical and see how the nurses work, so you can figure out which style or how you would like to be nurse, how you would like to do nursing versus what you might not like so much, and figure it out that way.
I totally agree. That is by far my favorite part, clinical. We didn't, with COVID, our cohort didn't get to do our first semester of clinical in long-term care. And so going into the hospital this semester has been like everything I hoped it would be. And I just feel like I'm in the right place. And the days are long, but they totally do not feel long.
Yeah, I'm going to be a copycat and run off all the things you guys have said, because clinical is, I didn't really experience it until yesterday, because yesterday was my first day on the floor. But like Jazmine said, I was freaking out. I could not sleep the night before. It was rough. So I woke up tired, exhausted. And then I get on the floor and my nurse was awesome. She's like, we're going to have a great day today. You're going to be doing a lot of things, which don't get me wrong, I was scared out of my mind, but she was there with me the whole time, and really helped me through it. So you'll learn a lot in classes, but you'll learn probably the most valuable information when you're in clinicals actually doing the work. And you'll pick up things that you wouldn't even think that you would need to know until you're there. So that's far and away the best part of nursing school.
Awesome. Thank you all. That was great. Like I said, we all love a good community. Community, I think, helps us all survive, really just getting through college and into our lives. So I think best way to sort of wrap up here, and Jacob, we're going to go to you on this one. And just if you could, what's the best piece of advice you could offer to students who are prospective, really trying to get into the program, and just in general as these new students are sort of maneuvering their way in whatever pathway that is into becoming a nurse?
Yeah, for sure. I think there's a huge fear factor when it comes to nursing school. Whether it's you're scared of how hard it's going to be, you're scared of even being able to get into the program, or whatever the case may be. There's just this huge fear around it. And that was the main reason why I didn't even want to apply in the first place, because I was scared. But I would encourage you, if nursing is really what you want to do, then go for it. Give it your all. Try your best in all of your courses, and focus on the ones that really matter. Focus on anatomy and physiology, because not only those courses are going to help you get in the program, but they're going to help you once you're in the program, because you learn a lot of that information again. Yeah, I would say just go for it. Do the best that you can. Don't stress. I know it is stressful. You're going to stress, but try not to. And especially when you're taking your pre-nursing courses, take time to take care of yourself, and prepare for nursing school the best that you can. And whether it's through Boise State or otherwise, if you really want to be a nurse, that will happen for you one day. You just have to find the right route for you.
Absolutely. Thank you, Jacob. Jazmine?
My best piece of advice would be to not freak out. Like Jacob said, it's really easy to get lost and kind of overwhelmed, but honestly, do well in your classes, because that's important. That will help you later on in your nursing career. But also have a life. Like if your friends want to hang out, go hang out with them. Take a night off of homework. Or if you just don't want to be in your room on the weekend studying, don't. Go out into the world and do something fun. My other advice would be, this isn't talked about very often, but I took Bio 227 twice. I know, shocker. And that's okay. It's not that big of a deal. I'm in the program. I'm here. I know a couple of other people in my program took it more than once. So if you have to take it again, don't freak out. It's much easier the second time, I promise. You learned more than you thought you did, and it will all work out for the best. You'll get in and you'll love every second of it.
Thank you, Jazmine. Matt?
Just like kind of piggyback, take deep breaths. Pre-nursing is only 3 semesters, but it's a longer 3 semesters with the due dates that you have for like your application and the classes you have to take. So just take deep breaths. There are going to be roadblocks. Don't freak out. Just, step back, take a deep breath, and move forward. And it's harder to do than it is to say, but just try to stay calm, try to stay relaxed. And then also, I completely agree with Jazmine, make sure you're taking care of yourself. Don't beat yourself up. Don't overstress yourself. Self-care is very important, both when you're pre-nursing student and when you're a nursing student. So just make sure that you're having a little bit of fun and you're taking care of yourself in whichever way that may be, while keeping up with your studies.
Thank you, Matt. And Dana, last but not least.
All right. Well, unlike these guys, I applied to nursing school 4 times before I started. So if it's what you want to do, like I said, clinical, the first day I was there, it was like, this is what I've been waiting 20 years for. It's just, if you feel like it's right for you, keep trying. And like Jacob said, if it's not at Boise State, just keep trying if you feel like it's right for you. And if you do get in, the first semester, there's a lot of classes and it freaked me out. And I had a hard time organizing everything in my head. But one of the professors said, you only have to get a 75%. They don't look at your grades when you're applying for jobs. So if you get in, congratulations, and don't freak out.
Awesome. Well, thank you all again. Really, really great stuff. Great information. And Jacob, you want to sign us out?
Yeah, for sure. Yeah, just like Archer said, thank you to all of you for coming today. And we really appreciate your insight into the program. And hopefully you pre-nursing students find this helpful and can learn something from it and hopefully reduce some anxiety and go live life, go have fun, be safe, social distance, wear a mask, all that, but have fun, enjoy your life. And we will hopefully see you guys soon.